All right, good afternoon. Happy Friday, everyone. My name is Chris Meyer. I'm a research analyst at the Maryland Center on Economic Policy. For any attendees who aren't familiar with our work, the Maryland Center on Economic Policy is a nonpartisan, nonprofit think tank that works to build broadly and equitably shared prosperity across Maryland. We know from our work that when it comes to advancing justice through policy, good intentions are not enough. There is no substitute for a strong knowledge base, and that's where disaggregated data come in. Disaggregating data, collecting and presenting data for population subgroups by characteristics such as race and ethnicity, gender, including gender identity, and sexual orientation, arms policymakers and advocates with the information they need to build opportunity, break down barriers, and advance justice. Today, current data disaggregation practices are far from perfect, but there are exciting efforts underway at both the state and federal levels to move data equity forward. We'll be hearing about those efforts today from three excellent speakers. First, Meeta Anand is the Senior Program Director of Census and Data Equity at the Leadership Conference on Civil and Human Rights. She will discuss recently updated federal standards governing data on race and ethnicity and their implications for equity-forward policy in Maryland and nationwide. Second, Caroline Medina is Director of Policy at the Whitman Walker Institute. They will discuss work at the U.S. Census Bureau to enhance responsible data collection on sexual orientation and gender identity, which has historically been extremely limited. And finally, we'll hear from Summer McClellan, who is the Mental Health Workgroup Coordinator at the Coalition for a Healthier Frederick County. She will discuss the significance and impact of data disaggregation for addressing and reducing health disparities, as well as the progress and advocacy of the Maryland State Data Disaggregation Action Network Workgroup. A few housekeeping notes before we begin. This webinar is being recorded, and all the speakers' materials will be shared with all attendees afterward. We'll be taking questions primarily in written form through the Q&A. So just any questions you have, please submit. Make sure to note who the question is for, and then we will go through questions at the end. And finally, we want to thank the Leadership Conference Education Fund, whose support is making this event possible. And with that, I will hand it over to our first speaker, Meeta Anand.
Thanks so much, Chris. It's a pleasure to be here, even if you made it seem like I paid you to let me speak right now. But it's a real pleasure to be here and to speak in front of this crew. If I could ask, I have asked that someone else control my slides for me because I don't trust myself. All right, so here we are. This is me. Next slide, please. And this is just that I wanted to just give kudos to the team that works with me on this. This is a work that's been driven by a coalition, but also by a team of people here at the Leadership Conference. Next slide, please. So I wanted to talk today about our national coalition work on OMB's race and ethnicity standards. As we go to the next slide, I'll give a bit of background. When people think of race and ethnicity standards at the federal level, people often go immediately to thinking through to the Census Bureau. People immediately like, these are the questions asked on the census. And amazingly enough, though that's the first thing we all think of, it is not the Census Bureau that sets the standards for how race and ethnicity questions are asked at the federal government level. It is actually governed by the Office of Management and Budget Statistical Policy Directive number 15. So that is what governs how race and ethnicity data are collected at the federal government level, regardless of who's collecting the data. I'll also make one more side note before I go through this a bit more, but because this is set at the federal government level and because we see it at the Census Bureau, these standards have a very sort of weighty emotional meaning to people. And a lot of times people just default to using them. There has been many a group I've been in where people were like, I put together a survey And by group, I mean social group or like semi-professional group. And they'll say, I put together a survey and I used the race and ethnicity categories from the Census Bureau because they thought about it. So, we know researchers use it, we know businesses use it. So we say it's at the federal government, but the point is it's used throughout, and we would hope that state and local governments would use it too. So what is this? It sets a minimum set of categories that agencies must use when they collect information on race and ethnicity. By minimum set of categories, what I'm saying is, like, you can imagine a world where it's, white and non-white as collecting on race and ethnicity, and that would be a minimum set of standards. So this here, what we're talking about is like that greater list, like what are the minimum categories you should be collecting data on? It was first adopted in 1977 in the wake of civil rights laws that were passed in the 60s and later. Interestingly enough, a colleague of mine here at the Leadership Conference was at the Library of Congress this week and found some of our letters from the 70s and 80s advocating for this directive and advocating for consistent race and ethnicity standards. So why was this so important? Because census data became a powerful tool in understanding how different communities were experiencing day-to-day living, what their lived experiences were, whether it be in housing, education, healthcare, employment, you name it, right? Like this was a way of measuring the effects of racism or just the everyday effects of structural decisions. Next slide, please. So we had a set of standards in 1977. Those were updated in 1997. And almost immediately after they were updated, various groups started calling for updated standards. Our old standards, and I'm previewing, like, we have new standards. The standards up until recently had 5 race categories: Asian, Black, White, Native Hawaiian, Pacific Islander, and American Indian, Native American, and then had an ethnicity category: are you Hispanic or Latino, yes or no? And almost as soon as these standards were passed, people started asking for new standards. They felt that the standards did not properly address how people thought of themselves, and also left out the MENA category of people, Middle Eastern North African. In the Middle Eastern North African category, if people put that they were from the Middle East North African region, they were reclassified as white. And the lived experience of many people who were reclassified as white, they felt was not that of someone who was white. And so they were often checking some other race. Hispanic and Latinos would feel like they'd answered the race question by answering what is your ethnicity question. Not all, some who are of sort of multiple or intersectional identities would check both. But there was a lot of confusion, like, why are you asking the same question again? So we really thought that we were not getting accurate data that were reflecting our communities correctly. So we were calling for revisions to the Directive 15, and the opportunity for these revisions to be made came about last winter, in January 2023. And we called for 3 key improvements to the Directive 15 in order to modernize the standards. One was have a combined question on race and ethnicity, and we'll see what that looks like in a second. Have a new category for people of Middle East and North African descent. And surprise, surprise, disaggregated data, the name of this webinar, and making sure that we were collecting disaggregated data wherever possible. So I'm going to go to the next slide because I think, oh, and we got everything. Okay, so I'm going to see, I hope that our next slide, if you can go to that. Okay, this tells us what I was just saying. There were old standards. We had the race, we had the ethnicity, And then we have a new standard. And what we got there was a combined question. What does that mean? Race and ethnicity are asked in the same question with a format of what is your race and or ethnicity? And in that whole category, you get that whole list plus ethnicity, Hispanic or Latino gets added to it, and Middle Eastern and North African gets added to it. And people can pick race and or ethnicity. So if people just want to put Latino, they just put Latino. If they want to put Latino and African American or Latino and Black, they can do that. It provides people the flexibility to truly reflect who they are. And disaggregated data by default. And there, hopefully my next slide, and my apologies, I put these together a few days ago, so I'm not 100% sure. Next slide, please. Yes, so here we are. This is what it looks like. So it's one long question. And you see how you have every single potential of race, political identity, which is how American Indians and Alaska Natives thinks of it, and ethnicity are all in one question so that people can see all their choices and pick what applies to them. What do we mean by disaggregated data? So here's an example. Let's look at the Asian category. You can click Asian, but what we want to do is get more detail than that. If you think about the size of Asia or the size of Asian American populations, it is useful to have a difference in Chinese versus Asian Indian versus Japanese to understand what differing outcomes and experiences they might be having as they live their lives. What this new standard does, this was always available. You could always write down something more detailed. But what this does is it requires agencies to collect that more detailed data. It is a requirement now, unless an agency makes a showing as to why they're not going to collect that more disaggregated data. And I'll give you, a very quick, we can give 100 examples as to why this matters. Since the word census is on the page, I'll give an example from the census, which is the Asian community in the 2020 census, according to the Census Bureau, was overcounted. Well, it turns out not to be that simple a story. It really depends on which part of the Asian community you're looking at, both geographically and the subcategories. So as you look through it, you can find out that Asian Indians were likely overcounted, whereas Vietnamese were likely undercounted. So it's stories like that, and you can picture that across the way, like in terms of educational attainment or housing availability. And this happens in many subcategories of many of these groups. Next slide, please. So we are thrilled. You saw that slide I ran through quickly where it was like, we got what we wanted, check, check, check. But nothing in life is ever perfect, unfortunately. And there are a few things we wish could be done better. And I bring these up here because what we really want to see is progress made at all levels of government, federal, state, local, and in the private sector. And in the nonprofit sector, which is as other groups start thinking about what does data disaggregation mean and how to implement it. We believe the combined question does capture the best data for the most amount of groups. But there are certain groups, certain subgroups, where the combined question might diminish the completeness of that accuracy. So as we look to implement this, look at further questions, we need to recognize that there are certain groups, Afro-Arab, Hispanic, Asian, that might not see themselves as flexibly in it, even though the flexibility is there, to really help people complete these forms as well as possible. To that point, there's a question of signaling for people within multiple groups. And if I could ask who's ever running the slides to go back for 1 second. I really appreciate it. If you look at this, under Hispanic or Latino, there are certain examples given, but the examples given are not necessarily from regions that have as huge of an Afro-Latino component. The Middle Eastern, North African, we don't see signaling as much from those countries in that region that, again, might have a huge Black population. So we really want to make sure that we're signaling to those people that really live across multiple identities to fill out as many boxes as they can to properly capture who they are and what their identities are. Next slide, please. Thank you for going back. And then the detailed categories that we saw, they were pretty well tested on the Asian side. There weren't as many tests done from the Hispanic Latino side or the MENA, Middle Eastern North African category side. So we really want people to explore, like, are these the best categories going forward? These are the categories for now, but we really want to make sure that we're providing a wide range of signaling responses. Next slide, and I'm going to finish up soon. I know my time is nearly up. So what happens next? We want to educate communities. I think that is part of the answer to, making sure people know they should fill out the forms as completely as possible, explaining to communities why these data are important, and how to think of filling out the forms and why it's important to fully express their identities. As I said, agencies are required to automatically collect detailed data without showing of why they should get exempted. So we want to work with agencies to encourage them not to apply for that exception or exemption. And we want to work with the federal government to ensure that they are doing that guidance signaling and coding, basically, how they're presenting the data. It's fine. You can go to the next slide. Thank you. So we're a bunch of things we're working on right now. And I'd really focus two things I'd really highlight here is that we're engaging with agencies on the importance of ensuring that mandatory detailed data part and thinking about what does multi-ethnic and multiracial mean. If we're encouraging people to fill out as many categories as apply to them, how do we then present and tabulate that data to be seen, right? You don't want just 2 or more races. You want to start seeing those categories like Afro-Latino or Afro-Arab to be able to truly get to those intersectional identities. And I think that's it for me. I'll be more than happy to answer questions at the end. Thank you.
Thank you so much, Meeta. We will definitely have questions for you at the end. Reminder to anyone in the audience, if you have questions, to submit them through the Q&A function, and then we will go through those at the end. Now I'll pass it on to Caroline to talk about work to improve federal data on sexual orientation and gender identity.
Great. Thanks so much. Can you folks see my slides all right?
Yes.
Great. Awesome. So as Chris said, I'm Caroline Medina. I use they, them pronouns. I'm Director of Policy at Whitman Walker Institute, and I'm really pleased to be here with y'all today. I am going to ground our conversation a little bit specifically in the American Community Survey, where we've seen a lot of exciting activity related to efforts to improve more accurate and inclusive data collection on LGBTQI communities. So the ACS, for those who aren't familiar with it, is really the premier source of social, economic, housing, and demographic data about the U.S. population. It collects information from over 3 million households, and unlike the decennial census, it is conducted monthly with data released annually. These data are really influential. So they're used to allocate almost $3 trillion in federal funding that's distributed to states, localities, and tribal communities across the country. They're used to develop evidence-based policy interventions, assess programs and service deliveries. So, for example, they're used to create statistics about the percentage and characteristics of insured and uninsured populations, to determine eligibility and inform outreach efforts, to encourage people to enroll in health insurance programs, and really just to help community-based organizations and others keep pace with their community's changing demographics so that they can offer better services to meet those needs. They're also really importantly used to monitor and enforce civil rights laws to ensure equal opportunity and to protect people from discrimination. And that's something that we'll talk more about a little bit later today. While we're on the topic of sort of the ACS overview, I think it's really important to name that these data are protected by Title 13, which also protects data collected through the decennial census. And Title 13 really represents the strongest confidentiality protections that exist in federal law. These are different and stronger than those protecting pretty much any other government-supported data collection. So the Bureau can really only use these data to create general information about the population. It's illegal for one's individual responses and any information that could be used to identify them to be shared with anyone. And there are really heavy fines and penalties associated with any violations. So as you can see, the ACS is an incredibly rich and valuable data set. Unfortunately, like the decennial census, the ACS currently only allows respondents to identify that they're in same-sex cohabitating couples. And that information is really important. Don't get me wrong, a lot of work went into that change happening. But that really reflects a very small share of the broader LGBTQI community. And it's estimated that those questions only capture about 1 in 6 LGBTQI people. So without explicit measures of sexual orientation and gender identity, or SOGI, we don't have ACS data about many parts of the LGBTQ community. And also because the ACS collects a ton of other demographic data, as Meeta was mentioning, related to race and ethnicity, as well as disability and other demographic characteristics. So without adding SOGI measures, we can't combine and look at sort of outcomes of different parts of really of those that are living at the intersection of like multiple marginalized communities. So without SOGI measures, we can't really support that intersectional analysis to look not just broadly at LGBTQI folks as a whole, but specifically what are the experiences of Black LGBTQ folks, for example. So essentially, because of the richness of this data set and because of its value in the various ways that it's used by federal agencies and really a host of other stakeholders, advancing data inclusion on the ACS has been a top priority for folks advocating for improved sexual orientation and gender identity collection. So the good news is that we're actually at a very exciting time. So in the fall, the Census Bureau published its Federal Register notice requesting that the Office of Management and Budget approve its plan to conduct a test of SOGI measures on the ACS. That's the 2024 ACS SOGI test. The test, unfortunately, does not include a test of questions related to intersex status, and I'm happy to talk more about that later if folks have questions. It's important to note that there is an established deliberative process to add new content to the ACS that the Census Bureau, in consultation with various other agencies, have to follow. And this process is really unique, so it's not like adding questions to any other kind of survey, basically. In this case, this process was initiated because federal agencies reached out to the Bureau and submitted formal requests, really articulating the statutory and regulatory justifications needed for collecting these data on the ACS. And so, for example, we know that the Department of Justice submitted a request that requested these data in order to better enforce non-discrimination protections in employment and to better address anti-LGBTQI hate crimes, and generally to sort of just do a better job of implementing its programs and doing so more equitably. So taking a closer look at the test itself. So the proposed test will evaluate SOGI question wording, response categories, and placement of SOGI questions on the ACS. These questions will be asked only of those who are age 15 and up. And it'll also look into proxy reporting where you have one individual answering on behalf of other individuals in the household. And this is a particularly ripe area of research related to SOGI measures where there is evidence that shows that this can be done and produce quality data, but that is more a limited part of the research. So it's incredibly important that the Bureau look into this. The Bureau is testing multiple questions to measure both sexual orientation and gender identity as distinct concepts. And those questions will allow folks to self-identify as lesbian, gay, bisexual, transgender, and non-binary. And I also really think it's important to note that there is a write-in option for both sexual orientation and for gender identity. And so that is really important to provide folks with a sense to use other terminology to identify themselves if they don't see their identity reflected in the current response options that are available to them. Respondents are also able to skip these individual questions if they don't want to provide that information. Now, how did the Bureau sort of determine what they were going to test? This testing really reflects research and evidence from the Federal Committee on Statistical Methodology and its Measuring SOGI Research Group, as well as the National Academy's consensus report that includes evidence-based best practices for measuring SOGI on general population surveys, where those questions will be asked of both LGBTQ and non-LGBTQ folks alike. At the very end of April, a second Federal Register notice was published providing even more details on the Census Bureau's plan for the field test, and they're planning for that to take place later this summer, which is, again, incredibly exciting. That second FRN provided far more details and actually sort of the design of the different materials that were going to be distributed as part of that field test. So I also wanted to wrap up today just sort of talking about a lot of the work that's gone into getting us where we are and also preview some of the work ahead. So in terms of mobilizing support, Whitman Walker Institute worked really closely with the Leadership Conference, the Human Rights Campaign, and various other of our partners in order to do a number of things. First was to generate multiple sign-on comments in response to the Federal Register notices that went out. That's incredibly important for the Census Bureau to receive feedback from a wide range of different stakeholders, providing feedback on their proposal. And those comments ultimately garnered the signatures of hundreds of different organizations across the country. We also developed educational materials, which are linked to in my slides, and I'm happy to also send a follow-up with that link as well. We hosted educational events for LGBTQ community organizations, for civil rights partners, for data equity partners, and a whole host of folks to make sure that they had the information that they need about the ACS and about the test in order to weigh in if they wanted to. We also are in regular communication with folks on the Hill to make sure that members of Congress know the importance of the Census Bureau moving forward with this test. And we've also been coordinating against opposition as folks who may be monitoring other LGBTQI-related issues or other census data issues. There are a ton of anti-LGBTQI riders that have been kicking around in Congress throughout the fiscal year 2024 appropriations process and now currently during the fiscal year 2025 process. So we've been working really closely with partners like the Leadership Conference, Human Rights Campaign, and others to really educate allies on the Hill so that they know about the importance of the Bureau moving forward with this test free from their interference. In terms of future efforts, Whitman Walker and Movement Advancement Project, who we work incredibly closely with on this topic, are about to start some first of its kind, really, community-led research, evaluating how LGBTQI folks feel about participating in the ACS. So that's an incredibly exciting project that we're about to embark on, and we're really excited to see some more of the results. We are also building infrastructure to make sure that there is a strong group of well-coordinated sort of strategic partners that are overseeing some of this work and supporting collaboration across movement. And that infrastructure is really important to make sure, we're continuing to stay in touch, to get the word out about the importance of this work, to communicate about the confidentiality protections that are in place to protect ACS data, and more. We are continuing our public education and awareness campaigns, doing events such as this one today with our partners. And then we're continuing to meet regularly with the Census Bureau, with folks on the Hill, with folks in the administration outside of the Census Bureau, just to provide regular feedback about the ACS and about their plans moving forward. And that stakeholder engagement is really key. So like I said, it's really an incredibly exciting time. This data set is just incredibly influential. So we can talk more a little bit about this, but SOGI data in general, there is not a comprehensive or sort of like robust amount of SOGI data that's collected through the federal government. And oftentimes other agencies will look to the Census Bureau for how to best ask questions about demographic data, including now SOGI. So the questions that get added to the ACS are very likely to be replicated by other agencies across the government, which would be great because it will make sure the data are comparable across different data sets. So it's incredibly exciting, and hopefully the Bureau will continue full speed ahead with this work. And I will stop there, I think.
Thank you so much, Caroline. And with that, we will move on to our last speaker, Summer McClellan, who will talk about work going on right here in Maryland.
Thank you, Christopher. All right, is everyone seeing my screen okay?
Yes.
That's all right. So hello, everybody. It is a pleasure to be here today presenting to you all. To share a little bit about me, my name is Summer McClellan. I am the Mental Health Work Group Coordinator at the Coalition for a Healthier Frederick County. In this role, I assist the Mental Health Work Group with their community efforts and hold them accountable to their initial action plans and logic models that they developed at the beginning of this local health improvement plan cycle, which I'll talk about a little bit deeper later, but I will abbreviate it as LHIP, just so you know. This work group's work revolves around increasing the behavioral and mental health workforce, as well as eradicating stigma in our communities. The coalition houses the work groups that are formed based on the data findings from our triennial community health needs assessment, known as the CHNA, which I will dive deeper into in a little bit. So I began working on the Data Equity Maryland project with my colleague, Akia Billups, who cannot unfortunately be here with us today, but she is the coalition's grants and data specialist. I started with her to assist with the communications and outreach components back in late March. Akia led the Maryland State Data Disaggregation Work Group, whose efforts revolved around increasing awareness and advocating for advancing data-driven equality and inclusivity. We have had the great opportunity to meet both virtually and in person with a few state local health improvement coalitions to share the significance of DDAN and the state work group's progress. So, as Caroline and Meeta have mentioned about data disaggregation, this process involves breaking data down into more specific subgroups based on various demographic characteristics, such as race, ethnicity, gender, income, and more. So you know when you are you may be at the doctor's or filling out some lengthy surveys or questionnaires, all those questions that you answer, this is so that the data collected is comprehensive and is able to identify any gaps and/or health disparities. The process is crucial for identifying and addressing health disparities across these various demographics. For instance, one of the coalition's other work groups focuses on the health priority of type 2 diabetes here in Frederick County. Disaggregating data related to diabetes can help reveal differences in disease prevalence, access to healthcare, and health outcomes among ethnic groups. Accurate data disaggregation informs more evidence-based policymaking and resource allocation. Identifying specific communities that may have higher rates of diabetes, for example, allows for more targeted interventions and education programs. An example of this is how our type 2 diabetes work group has received funding to fulfill 160 diabetes prevention program scholarships for those who either do not have insurance or their insurance does not cover the program, especially because we found that Medicare and Medicaid both do not cover the program. In the graph on the left here, we can see that Native Hawaiians and Pacific Islanders are all placed into one single category, revealing that their death rate was nearly 1.5 times higher than California's overall death rate. Below that, we can see that when the data is disaggregated into more specific categories, we see that the death rate for Samoans alone were more than 2 times higher than California's overall death rate. So, more into the state work group. The work group has promoted 3 essential actions to take, which are understand, act, and monitor. First, understanding the impact of data disaggregation is the first step. When we collect, analyze, and share consistent, comprehensive, and accurate data, we can better understand and shed light on the inequalities found in education, healthcare, housing, employment, and criminal justice. Next, we have ACT, which revolves around the data-driven approaches to change that we are making. One action that the state work group has taken thus far is disseminating letters to both state and local representatives that encourage legislative action on DDAN for equitable policies in the state of Maryland. By tracking and monitoring the impact and progress of DDAN together, we can all make adjustments and work towards creating a more inclusive community where everyone can thrive. So the DDAN work group has outlined several recommendations to continue spreading awareness about data disaggregation, encouraging advocacy and legislative action, and implementing the necessary systems for change. These recommendations include advocating for legislation that mandates DDAN, establishing statewide data collection guidelines, requiring that policies and programs undergo equity impact assessments, supporting training and capacity building to groups such as government officials and analysts, launching DDAN public awareness campaigns, as we have seen here today, and implementing systems for regular reporting on disaggregated data findings and outcomes. So I've already mentioned a couple of these, but I'll go a little bit deeper. The work group has combined all of their skills and passions to make great progress with this public awareness campaign. They've developed a letter to both state and local representatives, like I mentioned, that encourages legislative action, and it also includes the previously mentioned recommendations that I just talked about. They've also created an informational one-sheet that explains what DDAN is, its significance, and the recommended action steps. Beginning in April, we sent out 4 weekly newsletters to raise awareness about the work group's efforts and progress. In one of those, we invited community members from all over Maryland to signify their partnership and support with the Data Equity Maryland project through a partnership agreement form. Now, let's move on to how the Coalition for a Healthier Frederick is working to advance data equity and reduce health disparities in our community. In case you might be unfamiliar, the Coalition partners with both the Frederick County Health Department and the Frederick Health Hospital to conduct a triennial community health needs assessment. This CHNA examines community health statistics, compares it to both state and benchmark data, and identifies available resources to address health issues and resident perceptions about both health and social concerns. Based on this comprehensive data, focus groups, and public input sessions, health priorities for the next 3-year LHIP cycle are then identified. As part of the LHIP, volunteer work groups use that data to develop action plans and logic models to address the health disparities. The CHNA also allows for more informed decision-making and tailored interventions, like some things that I've mentioned about the funding for the type 2 diabetes work group. Every 3 years, the CHNA report is also made public and shared with our community, which helps guide policymakers and healthcare providers in developing strategies and allocating resources effectively. Additionally, this comprehensive data paves the way for more targeted interventions that cater to the specific needs of various community groups. For example, our CHNA survey asks for the individual zip code, which can then help us determine how many individuals possibly in a certain area that either are or are not participating in preventive health measures such as health screenings. The Coalition and our partners work together to ensure that the data is inclusively collected and that we utilize culturally sensitive methods. Our CHNA steering committee and data and assessment team are both open to the public, and they work to design the survey and provide feedback to make sure that it's both linguistically and culturally appropriate for our target populations, which is all of Frederick County. The Coalition serves all of Frederick County. We also make sure that we reach out and engage with traditionally marginalized and underserved communities to gather their imperative data. And then lastly, the survey is available in both English and Spanish, as we have found that these are the most popular languages here in Frederick County. Also, to make our survey participants feel safe to share their health experiences and thoughts without any fear of stigma or repercussions, we make sure that we heavily promote that the survey is completely anonymous and confidential. We recognize that some of our populations may experience technical difficulties or may require assistance with completing the survey. So we do offer paper surveys upon request, and we work with our community partners to offer that assistance to those in need. That is all I have for you guys today. Thank you very much for having me here. It was a great pleasure. So thank you for this opportunity. I hope you were able to learn more and gain a deeper understanding about the importance and significance of data disaggregation. And just remember that together we can all use these data-driven approaches to address and reduce health disparities in all of our communities. So thank you.
Thank you so much, Summer. And again, this is a reminder, everyone is welcome to submit any questions you have through the Zoom Q&A function. I am going to take moderator's privilege and start it off with a question for Meeta. Our bread and butter is fiscal policy, and something that we are always sure to emphasize is that everything that governments do requires sufficient resources to actually be able to do it effectively. So can you talk at all about the Census Bureau's funding and what that landscape looks like and how it will affect data equity?
Yeah, absolutely. More than happy to. And I skipped the last slide in my presentation because I wanted to make sure we had enough time for other presenters to talk about, but that slide did talk a bit about this. So for context, firstly, I want to take us to where we are in the census world. Right now, it's the year 2024. But we're preparing for fiscal year 2025, and that represents the halfway mark between the year ending in 0 and the year ending in 0. We're halfway to Census 2030. So that means planning is in earnest. As proof of that, this coming Monday, July 22nd, the Census Bureau will be announcing their sites for a 2026 census test. This is something they do to see, like, how do the methods work? What do they need to tweak? How does it work for different communities? It's a very important test. So, like, think about it. They're knee deep in planning which sites they're going to run a test on for the 2030 census. Most sites were canceled ahead of the 2020 census. Only Providence, Rhode Island actually ended up having a test run. And many advocates blame that for having poor results coming out of rural and other communities. So I just bring that up to let's think of where we are. We're halfway through. That means money for the Census Bureau should be ramping up on a year-by-year basis. Census advocates have been calling for $2 billion worth of funding a year for the Bureau, which may sound like a lot, but I encourage you to look and see the amount of funding other agencies and other types of programs get. It's minuscule compared to that. Currently, the version of the funding for the census that is on the House, that is before the House, has funding for the census going down for fiscal year 2025 as compared to fiscal year 2024. That means a lot of the things Caroline and I talk about, like not just testing of race and ethnicity questions or SOGI questions, but just like the quality of the data, testing new means of ensuring we're getting the data, like seeing, like, is it better to ask the question first or second, making sure we're getting to the communities that I presume everyone on this call cares about. We're here because we want to make sure our most vulnerable communities are seen and taken into account as we make policy decisions. And to reach those communities takes that much more testing, research, and effort. And so when we don't do the proper funding, that's who we miss. So that's really the landscape we're facing right now. There are other things going on that undermine the quality of the census, but just purely talking from a budgetary standpoint, we are not looking at what we want to look at, which is an increase in funding. We're looking at a decrease in funding, and it leaves me concerned about the quality of the data we're going to be looking at going forward.
Thank you, Meeta. A question for Caroline. So Meeta told us a lot about this very in-depth process for developing new standards for race and ethnicity data at the federal level. And you were talking about sort of a more basic work of just collecting data on sexual orientation and gender identity at all. And so I'm wondering, does the federal government have sort of official standards on what sexual orientation and gender identity data should look like?
Yeah, it's a great question. The short answer is no. So there is not something like Statistical Policy Directive 15 for SOGI measures. Probably one of the closer things that has come out is that the Office of Management and Budget, which again, shapes SPD 15, did put out guidance for how to ask SOGI measures on federally supported general population surveys. And they put that out, I want to say a little over a year and change ago. And that was as a result of an executive order that was signed in June 2022. It is not binding. It does not have the teeth to it that something like a formal OMB circular or a statistical policy directive has, but it is still really important, and it's a step in the right direction because OMB is charged with coordinating the federal statistical system. So now agencies looking to add these measures do have an important resource to look to from OMB itself. But again, this is partially, speaks to the importance of the ACS. It is a huge survey. The research that the Census Bureau is doing, it will involve like a much larger sample of respondents than any other sort of research that we've really seen on collecting SOGI measures. So that's part of the reason why there's so much investment in the research that the Bureau is currently doing, because their findings really could inform a future statistical policy directive. I will say there are some agencies that are also sort of taking steps to standardize their SOGI data collection. So, for example, CMS at the Department of Health and Human Services recently put out an updated demographic data collection sort of standard, and that is inclusive of SOGI measures. Again, that is not a mandate per se, but it does really help sort of guide folks that are interested in improving LGBT data collection with an important resource. So I think this is part of the reason why the ACS has been such a big focus for many organizations. In addition to how the data themselves will be used to advance equity, they'll also be informing future government efforts to improve data collection across the federal government, and then also through the states, hopefully as well.
Awesome, thank you. I have a question for Summer, but first I just want to again say we definitely, we've got about 10 minutes left and everyone is welcome to submit questions. Don't be shy. Summer, I'm wondering, as you talk to stakeholders around Maryland about the importance of data disaggregation and data equity, are there barriers that you encounter or pushback that you get from stakeholders? And how do you address that?
That's a good question. I honestly can't say that I was too much involved in that, as I explained how I came onto the project in late March after they had already conducted that outreach and such. We did host a convening on June 20th, and we did have a pretty good turnout. I mean, obviously it could have been more. But the way that we go about that is maybe if someone wasn't able to attend, as we know everyone's schedules are busy and such, we did host it hybrid, so people could join either in person or virtual. We hosted it in Frederick County, but obviously we would love to reach everyone in Maryland. So we made sure that we recorded it and shared all the materials and slides publicly on our website and with everyone who registered. And as for reaching out to like other stakeholders, like the state and local representatives, I don't believe that there was a very much too big of a response with those. I think it's, you know, one of those things you get in your email and might just pass on. So yeah, we never heard back from any of those representatives.
Thank you.
Mhm.
I'm going to pass it to Meeta. This is kind of jumping off of an audience question that we got. How were the checkboxes for detailed racial and ethnic subgroups chosen? And are there limitations to that and avenues to improve that, you know, in the next update?
Yeah, sure. The new Statistical Policy Directive 15, which was announced on March 28th of this year, has announced the detailed categories, and they took what some might view as like, you know, the easiest approach, which is basically they took those groups that are the largest ethnic subgroups, largest subgroups within the United States, right? So they looked at Asian, for example, and said, based on ACS data, it looks like our largest Asian subgroups are Chinese and Asian Indian and Vietnamese, and those showed up. And then they did that for all the categories. So that is how they were picked. What are the limitations? I will give you two limitations. I'm sure there are more, and I'm happy to hear others who have other limitations. One is that there are, as I already indicated, there are people who have identities as a result of being a part of a diasporic community. So you might be a transnational Armenian that doesn't necessarily show up in the subcategory under MENA. You might be someone of Japanese ancestry who lives in Peru, and that doesn't necessarily show up. So like you have these sort of like interesting groups that pop up where it's not as an obvious identity, and we're not getting to the more vulnerable identities when we're going with just the largest ones. The second issue is like, because we have a world with migration involved in it, we think it would be more interesting and more reflective if you had people coming from different regions. So if you, for instance, for Black, you show people coming from Africa and you show people coming from Latin America. For MENA, like you have, like you're more deliberate in picking the regions that show a variety of potential races and different regions within the subregion. So I would say those are the drawbacks. Ways to change it. So the OMB has committed that it will not be 26 years before they do it again, 27 years before they do it again, and that they'll be revising it frequently. There is a procedure laid out in the directive itself where if the ACS starts changing their subcategories, you can change the subcategory to match the ACS. So the sort of way out is to sort of like work with the ACS and like see which categories start make sense to include in the ACS, and then other agencies can follow. I mean, what Caroline said before is spot on in terms of, you know, if the ACS starts doing something, other groups will do it. And here it's even sort of mandated, not mandated, but like explicitly allowed, like you can do what the ACS is doing because we know that works.
Excellent. So one audience question that we got, many communities like Indigenous communities have been subject to significant harm by the government as a result of data collection. I think that we can also say that's been the case with LGBTQI plus communities, immigrant communities, and, you know, people with health conditions. So I think I want to throw this out to everyone. How has your organization or the stakeholders that you work with engaged with those communities to, you know, acknowledge those real harms while, you know, encouraging participating in data for the ways that it can advance equity. And I think whoever wants to start.
I can probably start. It's definitely something that's been top of mind for Soji questions. We understand that there is a history of misuse and weaponization of the government to target particular communities, that it would be naive to deny that. When we engage with communities through the various sort of channels that I've mentioned in terms of, briefings, coalition calls, webinars, all of those sorts of events, we are really upfront both about the incredible importance of the ACS, but also the confidentiality that protections that are offered under Title 13, which again are very unique and are incredibly strong with very serious penalties. Really, what I think we try to do is make sure that members of our communities have the information that they need in order to make a really informed decision about disclosing that information. And so I think it means empowering people with knowledge and information about the ACS so that they can sort of assess that risk, while also keeping in mind that there are real benefits, to having greater visibility in some of these data sets in terms of programs and services, as well as, enforcement of civil rights laws. That, there was a very clear ask for collecting these data in order to enforce civil rights laws to protect LGBTQI folks from discrimination, which unfortunately remains all too pervasive. So we know folks have questions, we know folks have concerns. We really try to get them the information that they need in order to make a decision about sharing that information and seeing sort of the larger picture of how the data are collected. But I know this is something that has come up a lot, and we worked in really close partnership with the Leadership Conference, with NALEO, with MALDEF, with other organizations that have been doing this work for a really long time, and have similarly had to do outreach to communities who are concerned about being targeted. And so I think it's also important for us to remember that, people wear many identities, and also LGBTQI folks are not sort of in this alone, and that we have really good partners in this space as well to sort of advance this project and also defend our rights. I will let anybody else who wants to speak jump in.
Thank you, Caroline. I actually am going to jump in. I posed the question to everyone, but I'm looking at the clock, and we are just about out of time. I want to thank all three of our speakers. These have been extremely interesting and informative presentations that you've given, and we've gotten some great questions from the audience. As a reminder, this webinar has been recorded and the materials will be shared with all attendees. Thank you all so much for coming, and I hope everyone enjoys the rest of their Friday. Thank you.
Thank you.
Thank you.